Well, hi everyone. We've all had low back pain, and thankfully for most of us it just goes away. But when it won't go away and it keeps coming back, it drives you nuts. And so we're trying to figure out some of the reasons for this. And today I want to talk about how the foot connects to the back. The foot, ankle, knee, hip, back are all connected if the arches are not supported. Hi, I'm Dr. Brian McGuckin, downtown Frankfurt, and I want to talk about the importance of checking your foot, your arches, and your shoes. So you can do this at home. You want to check and see. You can do this with your spouse, with friends. You can check and see your own stability. The spine should be straight through the pelvis, and it's going to start with the feet. What we're looking at is the arches, and on the ankle, these bones here, the calcaneus, they'll stick out, and they should be even. And the Achilles tendon should be straight up and down, go with a straight line going up through the knee into the hip. That's what we're looking for, is a nice and straight on both sides. So here's the Achilles tendon, goes into the calf muscle, which would be here, and at the base of the ankle. And it should be even across the bones that stick out. What we're evaluating is the arch. That arch would be here, and that's supporting that foot and giving balance. That's what we're looking for. Now, if that arch is collapsed, it'll fall. So here's the arch. And if it's not where it is the height that we want, it will collapse, and you'll see a cave, and then you'll see the knee bow. It's going to go in. It's going to strain the hip, and what actually happens is this side will actually drop because the arch isn't here. So this hip, the top of your hips, will actually be lower on that side compared to the other side, which is going to put strain. It's a bowing effect, and it actually twists the spine, and the joints of the spine then are irritated, and that is part of one of the many reasons for a chronic coming back low back pain. It just won't go away, and it drives you crazy. So we start at the base for our evaluation and work our way up to find out where is the instability. Then what we use is a laser to actually identify how much arch height do we need to correct for that. But there's three of them. There's also what's called a metatarsal pad. It goes across the base of your foot. Now the reason for that pad is it takes weight off of, or excess weight off of, the very first knuckle, that very first joint. There's your bunions. We want to prevent that. There's a third arch off to the side, and that's for stability. As you get older, as you past age 60, receptors that are in the Achilles tendon and the base of the foot, these receptors change. They're not as responsive, and the ability to fall or stumble increases. And there's an easy exercise to help correct that, but the arch supports also help stimulate those receptors to keep them alive, keep them active. That way we stay on our own 2 feet. But that's part of this chronic low back pain, is instability, and it starts at the feet. At home, on carpeting, stand on one leg with your arms folded. I would support myself with the one arm against a door or against the wall for stability. What we're checking is how, it's not the strength so much as the coordination between my brain and my ankle. Can I stand on one leg? And it's with your socks on carpeting, 1 minute each leg. That retrains the brain with the receptors in the bottom of the feet, the Achilles tendon, and will help with stability. So it's a great exercise. Just For safety reasons, just hold on to the wall, hold on to a door, be safe, and that's a good way to begin the process of strengthening your ankles and helping support. We use a laser device that measures the foot, and it gets very, very precise, very accurate. We have great success with it of checking the arches of the feet, and that does really help. So those are one thing you can do at home, one thing we do here at the office to help with these naggy backs that just won't go away, as well as for strength with the walking and stability, fall prevention, and the ability to be on your feet longer. We've had good success with those orthotics in that regard. All right, thanks for watching. Have a great day.